Namaste. This is Dr. Satyendra Katewa. I'm a pediatric hemato-oncologist and bone marrow transplant physician, and I work for Shalby Sanar International Hospital, Gurugram, Delhi NCR region. Now, one of the important question is what exactly is a haploidentical bone marrow transplant and what are the different types of it. So, to do a allogenic bone marrow transplant, which means you need a donor. Now, once a donor is evaluated against the patient, it is evaluated on the lines of HLA report. So, what is HLA? HLA is the matching of the genetic matching of the two individuals, human leukocyte antigen. So, we do HLA of patient and then all available siblings. If the patient is the only kid of the parents, then we involve the parents as well. Now, haploidentical means with the available HLA report, there is no brother or sister which is matching 100% with the patient, or they are just matching 50%, or the parents who are just 50% matching. We call it haploidentical, which means 50% matching. Now, what are the chances? 99.99% of the cases, somebody in the family, whether it's the sibling or the parent, will be at least 50% matched. Now, that's what it's simple, haploidentical bone marrow transplant. But there are two different types of haploidentical bone marrow transplant. One is T replete and the other one is T deplete. Now, 50% matching means 50% mismatching, and that means lot of complications are anticipated in these transplants. Now, how do we settle those troublemaking cells is the crux of haploidentical transplant. Now, in T replete, we collect the cells, the stem cells from the donor, and we give it to the patient. They create lot of cytokine storm, lot of chemical reactions inside the patient's body. And after 3 days, on day 3 and 4, we give a drug with the name cyclophosphamide, and we call it post-transplant cyclophosphamide, which kills all the problem-creating cells. This is an American John Hopkins University devised this protocol. We call it sometimes John Hopkins style haploidentical transplant or T replete haploidentical transplant. But there is a different way of doing it. That's the German way, in which there is a special machine comes with the reagent, and before transplant we remove those cells which are likely to cause problem later on, which means we collect the cells, the stem cells from the donor, then we pass it through that machine, and the machine remove all those cells which are likely to create problem. Now, the most commonly one which is nowadays being done is TCR alpha, beta and B cell depletion haploidentical bone marrow transplant. It's just the two type of cells we are removing and the rest of the cells we are giving. This is German method. This is costlier, but it has got less complications. It has got early recovery of neutrophils. It has got less bacterial sepsis and better outcomes. So there are few diseases like Fanconi anemia where we would want the patient to have this type of 50% match transplant. So once you need a transplant and you do not have 100% matched donor available in the family, whether you T replete or T deplete, we give one of this 50% match transplant to you, and that's what we wanted to explain you. I hope this helps you. Have a great day. Thank you.